We're going to talk a little bit about Botox of the masseter. That's Botox down here. Now, probably you're familiar with Botox being performed for wrinkles around the eyes and the smiling areas, or even around the lips for wrinkles. There is a separate video for that if that's what your interest is. What we're talking about today is using Botox in a very different manner. Botox is used to actually reduce the size of the muscle over here. And the reason that someone would like to reduce the size of the muscle is that if they've got a particularly square jaw, it can be very flattening, it can be very masculinizing, and it can just look simply unattractive. Interestingly enough, I've done Botox masseter reductions in Caucasians and Hispanics and Asians and men and women. So it's almost across gender and it's almost across ethnic divides. Probably the most common person that presents to me that wants to have this done oftentimes is a Korean individual that has slightly wider face in the jawline based on some of the anatomic dimensions that are common in some Korean patients. Although I've done it in Vietnamese, and I've also done it in Chinese, and I've also done it, as I said in other races as well. Essentially, it's a very short, pain-free, a few minutes office procedure, putting Botox along the jawline to help reduce the shape of the jawline, to take it from a square into a more natural oval shape. Essentially, with this procedure with Botox, it's a pain-free office procedure, as I said, and the difference between this type of Botox treatment and the Botox treatment you're getting in the wrinkle area is that for wrinkle treatments, you see a benefit even within about a week to 10 days. With Botox of the masseter, it takes about 6 weeks before you start seeing the improvement, although some patients see it earlier on. The difference, though, at about 7 days is you'll feel that this area is much softer. For people that are candidates for this, I usually have to do a very good evaluation, and the way I can usually tell if you're a good candidate for this, in other words, to differentiate whether it's a muscle problem or if it's a bony problem or it's a fat problem, is simply for me to have you bite down on this and feel it. When I bite down and I feel my own jaw, it's very soft. If you feel your jawline is very, very hard, you're probably a good candidate to have this done. Some of the other things that are important is to understand exactly what may predispose you to have this wider jawline to begin with. It may not just be something you're born with. You have to look at habits, chewing gum a lot and chewing on ice and chewing on hard things. In the Asian cultures, cuttlefish or dried fruits or dried things like that, betel nut, all those things can predispose toward having a larger muscle, in which case, even though Botox can treat it, I don't want you to constantly have to pay for something where you could have treated it if you just changed your habit or your lifestyle. The after results, there really is almost no recovery whatsoever. It's just patience to see the change. Some of the Korean studies that have come out recently have said that this type of treatment is permanent. And I don't know if that's necessarily the case. I've been doing this for a few years now. I've seen my results definitely last significantly longer than Botox for the upper face, which may last 3 or 4 months. The minimum time that so far I've really seen is at least 6 months, although your results may vary. And oftentimes even up to 9 months to a year or beyond with the treatment. And so that's a very favorable outcome. I'll take your before and after photographs and really show you the changes there. And sometimes even at a year, I may look at the person and compare the before and afters, and I can see a little return to baseline, but it's not necessarily all the way there. The reason that I don't do bony jaw reduction surgery, which is an alternative strategy for it, is number one, is even though I did train to do this in Korea, it is a very morbid procedure. In other words, it really has a very long recovery time. And also there's potential complications that I don't want to subject my patients to. Now, for doctors that do this all the time, that have a very low complication rate, I certainly understand the attraction of doing something permanent like a bony jaw reduction. The other reason I don't do bony jaw reductions is if you look carefully at the before and after photographs of people that have had bony jaw reduction surgeries, the outer table or the outer portion of this mandible right here looks cut off. And almost no human being has a cut off mandible or jawbone that goes diagonally. It looks almost like an animal's jawbone, and that's something that is very common with jawbone reduction procedures. And with this very simple Botox reduction, I think it's a very nice alternative to people that want to do a little bit of facial shaping.